So the next topic is the subtalar joint arthritis. So subtalar joint is the joint below the ankle. There are several causes of the subtalar joint arthritis. It can be occur after post-traumatic arthritis, including calcaneal fracture, telar fracture, rotational ankle injury, talocalcaneal collisions, tibialis posterior dysfunction, or can be primary arthritis or inflammatory joint arthritis. So patients usually are presented with pain, and the pain in the subtalar joint was different. So the pain going to be on the lateral border of the foot. You can see here on the circle. So pain on the lateral border of the foot. Sometimes the patient can present with instability because the ligament here was insufficiency or torn, and then as chronic instability causes arthritis. And sometimes if the patient have this problem for a long period of time, they can start having a deformity, and then the heel can be turned into villus contracted as shown on the right hand side. So here's the picture of the clinical presentation. So the patient going to have some swelling and pain in this area where the subtalar joint located. So on examinations, you can see pain and swelling. You can see instability, or sometimes it can be stiffness or deformity. So X-ray, which you forgot on the subtalar joint, and here's the ankle joint, and here's the subtalar joint. You can see the joint space obliterate. You can see marginal osteophyte, subchondral sclerosis, and sometimes you can see the subchondral cyst. And here's the CT scan of the same person. You can see the subchondral cyst right here. So here's the evidence of the subtalar joint arthritis. So the treatment of the subtalar joint arthritis, you can try a conservative management by modifying the activity, less walking, especially on uneven ground or uneven surface. Corticosteroid injection can be helpful as well, but usually helpful temporarily. However, if the conservative treatment fails, surgical treatment is indicated. The objective for the surgery is the fusion. We try to do the solid fusion of the subtalar joint in acceptable position or alignment in order to eliminate pain and improve function. So you have several techniques. You can do open, you can do minimally invasive by using a camera. So here's an example of the open subtalar joint fusion. You can use the skin incision from the tip of the fibula along with the false metatarsal base, and then go in and clean up the joint, and then the fusion with the screw. Or you can perform by arthroscopy. There are two commonly approach. We call lateral approach or LASTA, and posterolateral approach we call PASTA. Here's an example of the picture of the PASTA. And here's the subtalar joint when we look from the back. Okay, if you remember, this is the ostraconum that we talk about. This is the FHL flexor hallucis longus tendons. So this is a subtalar joint arthroscopic view. This is the subtalar joint right here. Okay, and here's when the patient have a problem with the subtalar joint arthritis. You can see the bone spur, and then we're gonna go in and then clean up the joint right here. But before we go in, we need to denude the bony impingement and osteophyte from our pathway that we're gonna go into the joint. So we clean the cartilage. Okay, we can use a shaver, or we can use a curette to clean the cartilage. Okay, after we clean, it's gonna look like that. And then we're going to do fusion, okay, by to the screw. So the next problem is we call ankle arthritis. So ankle arthritis can be happen from post-traumatic primary ankle arthritis or inflammatory joints such as rheumatoid arthritis, or sometimes it can be occur after the long standing of the hemarthrosis, like patient with